It's a good question. It's challenging because, just speaking from my experience in Texas, we have practices in Dallas and Houston, very metropolitan areas, very fluent areas in many cases where, patients are well equipped to manage cancer care, whether that's financially, emotionally, support systems, things like that. And then we have patients in very rural areas where they may have to drive, even though we have locations across the state, they still may have to drive an hour, hour and a half just to see a physician. Sometimes telemedicine is not an option for them because there's no broadband access out there. And so it's challenging. And how do we address those disparities in care that we see? And you can look at, states that are very fluent versus those that are more rural by nature. There's distributions in those states. Even in our metropolitan areas, there's distribution between our affluent areas and the poorer areas in our cities. And how do we meet people where they are? It's not an easy solution. I don't think there is going to be an easy solution to this, but I do think at some level we need to start thinking differently about payment reform as it takes into those socioeconomic and geographic disparities of care that we see, and how do we incentivize practices to not do the easy thing, which is taking care of the affluent who have more resources and are able to mitigate ER visits and things like that more effectively just because of their ability to do so. And how do we really incentivize practices who work and practice in areas that have more need to be able to support them so that we can smooth out some of the challenges that we see in those socioeconomic disparities of care.